the show. Dominic's awesomeness today. We are here at My Pet's Acupuncturist.
Okay.
Hi, Dr. Meir.
Hey, how are you, Dominic?
Thank you for letting me interview you today.
You're welcome.
I'd like to start today by asking you a few questions.
Okay.
How long have you been a vet?
Oh, man. 25 years.
Okay.
It's a pretty long time, isn't it?
What made you choose to specialize in acupuncture?
Well, that's a very good question. I have always thought I was more holistically minded and was somewhat frustrated with some of the limitations in general practice of what can be done with medicine and surgery. And I also had some back problems in myself, and I had acupuncture done, and it was very helpful to me. So I really was impressed with its effects and thought I wanted to train in animals.
Okay. What does acupuncture treat?
Well, it can treat a lot of different things. It actually helps encourage healing of the body. So it can help with things that are painful sometimes, like arthritis, or if you sprain your ankle or have an injury. It can help encourage healing if there's a wound or been trauma. It can help with the immune system. And so it really helps restore some balance to the body. It can be helpful in many different ways. But I think the way people think of it most often is with arthritis or back problems.
Okay. Does it treat something better than the other?
Well, I think the things you can see the fastest relief from would be something that was painful. So yes, I mean, it's probably the simpler things to treat would be arthritis or back pain or, trauma where you've hurt yourself. So what are called musculoskeletal problems are probably the simplest things to treat or fastest way to get relief.
Okay.
Does that make sense?
What exactly is acupuncture?
That's a hard question. Well, acupuncture, the definition of acupuncture would be placing needles into specific locations to stimulate the body to get an effect. And so there are specific locations. There are actually over 400 acupuncture points available on a dog or horse or cat, and we usually use maybe 10 to 20 needles at a time. And the location of where the needle's put is very specific to the effect we're trying to get. And some points are local. So if like Missy's elbow hurts and I use certain acupuncture points around the elbow, that would help. And some effects might be away from the area that we're treating.
Okay.
Is that good?
How many patients do you help make feel better?
Well, in a day like today, I think we see probably about 10 patients. And then I'd say I treat 40 to 50 patients a week, typically. And some patients, like the last patient I saw, was a fairly young dog who was diagnosed with heartworm, who was kind of somewhat of a rescue. And that was more of a consult to talk about how the dog's going to be treated. So sometimes I'm not doing acupuncture on everybody, but we sent home some supplements and some other things with that dog.
Okay. What are your favorite animals to treat?
You mean like dogs versus cats or rabbits or horses?
Anything.
Anything. Well, I like lots of Labradors. Cats can be challenging, but not yours. So, I mean, big dogs are often, I would say, my favorite because they often are happy about coming in to be treated and
Right, Missy.
not so worried. Yeah, Missy's nervous, but she's not right now, but she's a good girl. Some of the little dogs I see don't like to be, have anybody do something to them. It really varies with the dog, but I think big dogs are my favorite.
Okay. And now Dr. Meir is going to demonstrate how she performs her skill on Mr. and Missy.
Questions for me? Can I put a needle in them? Or needle in the head? Okay, thank you. You're going to tell me where to put it?
He likes the needle in the head.
That's a good starting point for him. So Dominic, what's your interview for?
School.
Cool. Have you done interviews before? This is the first one. I did a good job. This is a working interview. That's what's called when you're interviewing somebody while they're in process.
Okay.
Yeah, he trembles, doesn't he? He's closing his eyes now. Yeah, you're okay, mister. You're a good kitty. Oh, you are terrific. And we'll weigh him too here, but
That's on capture. Are you gonna put that on YouTube?
oh, I hope not.
Okay, maybe she is.
We'll both be famous, huh?
Don't worry about it.
You're a good kitty. Comforting. You're okay, you're a good kitty, you're a good boy.
Mister get cords on his nails.
That's a good question. This is called electroacupuncture, and it can increase the effect. And cats often carry a little bit more energy at their surface, so they're more sensitive sometimes. So sometimes we don't need to increase the effect in some cats.
Okay.
Does that make sense?
Thank you.
You're welcome.